Hi, I am a 65-year-old who has recently been diagnosed with Alzheimer's disease. Mild, probably step three, or, and I might be going to record my journey through infusion therapy with Kinsula. It's also called donanemab. I'm trying this out right now, but I think I've gone through the stage of grief, kind of, in getting this diagnosis. I do have a family history of it, and my aunt and my grandmother on my dad's side of the family. And in evaluating me, first I had a few MOCA tests, which declined quite a bit over a period of maybe 4 years. I had a neuropsych exam 4 years ago, which showed mild cognitive impairment. And then I had another neuropsych exam that showed progression of that. And I also had gene testing, and I do have the family gene. I think it's a P4 or something like that, and P3. I don't know if it's P, to tell you the truth. But anyway, this is Alzheimer's. So I also had a PET amyloid scan because Alzheimer's, apparently, you have these amyloid plaques if you have Alzheimer's, and they score those plaques at a certain amount. So I have 120, and the scale is really from 0 to 100. So that's a lot of plaques. These amyloid plaques can be removed with this therapy, this infusion that I'm going to have. That doesn't cure me of Alzheimer's, but it will give me, maybe I should say, stabilize where I'm at. And it gives me extra time before I slip into the other stages. Right now, my memory is not good, and I don't communicate really all that well. But I am independent, living on my own, trying to organize myself, trying to have a dog, trying to exist. I do know what is around the corner. And I looked into this quite extensively. I haven't had any experience with taking care of anybody with Alzheimer's at this point because my aunt was in California and I wouldn't have taken care of her, and my grandmother, I wouldn't have taken care of her either because she had her sons taking care of her. But so I start this therapy, which will slowly remove the plaques. It's over an 18-month period. But basically, what they're doing is they want to clear all the plaques. In my case, they want to get the plaques down to 13%, which will take it from the 120 to 13. So it has been approved by the FDA, and I'm going to have the first infusion done on the 21st of July. I there's no sense in really going into all my symptoms or anything. I just thought I might start this YouTube video to maybe walk people through the journey. So on the 21st of July, I'm going to post another video of the experience there while getting the infusion, and then just document my journey all the way through. There are some not so serious side effects that are possible and some more serious side effects. The not so serious are the flu type symptoms, headaches, could get a skin rash or whatever. But my infusion is for 1 hour, and then I am going to be monitored for an hour afterwards to see if these, come up during that time. Then within the 21st 48 hours, once I get through that, there most likely is not going to be any of those symptoms that I just mentioned. I mean, I'm through it. However, they have a 24/7 nurse answering the phone, and if I have any questions or any funny symptoms or anything that I'm concerned about, so I can contact them at any time if I'm uncertain. And then also there's some more serious complications, and it's called ARIA, ARIA. And it stands for something, but what it really is either edema, which is brain swelling, or you can get brain bleed. I believe my percentage, the possibility of me having this is about 27, maybe 30%. The infusion is once a month. So after I get through that 48 hours, I still, could have some concern with the ARIA. However, 1 week after I have the infusion therapy, I am scheduled for an MRI so they can check for that. There have been some cases of this. Often it just goes away on its own. But they monitor you pretty closely. I think I have approximately 3, maybe 4 infusions. I'm going to have MRIs pretty much after those, each one of those. Once you're through the 4th month, the serious side effects, probably all the side effects, are a little less apt to happen. Usually these side effects happen within the first 4 months if they're going to happen. And I think I already told you that I have 18 months unless I get it down to 13 before the 18 months is up, and I can quit. And then you just stop it. And of course, they're looking, right now, they're actively looking for what to do after that with some of us patients. Like they're still trying to figure out how long this lasts. As far as I know, they can't really tell you. I don't even really want to speculate on that because I don't even know for sure what I'm saying. So this is a raw video. I'm not editing it or redoing it over and over again. But I should be back posting another video on the 21st of July, just showing what the infusion was like. Maybe with some conversation. A good friend of mine will be there with me. And when I come home, my daughter will be spending the night with me to kind of get me through that first 24 hours. Yeah. So I feel very blessed that I am near a facility, that gives these infusions out, because I know there are rural areas out there and that might not even really know about this unless they're looking into it on YouTube or something. There are people that would have to travel further than I to get this therapy, and that my insurance, Medicare, I had to register for Medicare through Medicare with Alzheimer's, and Medicare pays for a good amount of it anyway. So I just feel really blessed that I have this opportunity, even though there are some risks. I feel the benefits outweigh the risks, and I can't sit here and do nothing. When there's something to do, I just can't sit here and not do anything. So hopefully I'll see you on July 21st. Thanks.